Hello all, welcome to Emergency Medicine Simplified. So today I'll just give you a simple tip on how to differentiate various snake envenomation. So as you know, one of the important thing that we look into is the clinical features by which the victim comes to us. So with the clinical presentation, how will we able to differentiate between various types of envenomation? Suppose you all know that there can be two types of major envenomation. One is hematological and other one is neurological manifestation. So depending upon these manifestations, we will be able to differentiate what type of snake or what type of venom has been injected to the patient depending upon the clinical presentation. And whatever it is, we only have polyvalent anti-snake venom to be available in our hospital. So that is what we need to give it for a patient with snake bite. So the first one, you have a patient who has come with you, who has come to your emergency with a pain at the bite site, and he also has bleeding manifestation. So that is the classical finding of any Viperidae family. So any viper species, they will have pain at the bite site, as well as there will be local reaction and there will be bleeding manifestation. So that is one presentation that you need to remember. Second type of presentation, you have local features with neurological manifestation. So you have local features, that is, there is a fang mark, there is swelling, there is localized lymphadenopathy, and there is pain at the bite site, maybe blister formation with neurological manifestation like ptosis, etc. So that is the classical of the cobra. What you are seeing is the Indian cobra. So that is the second type that you need to remember. The next type, you have local reaction, you have neurological as well as hematological manifestation. So you have both neurological like ptosis and the patient is unable to speak, or maybe a bulbar palsy, and hematological abnormalities as a bleeding manifestation, prolonged INR, or a positive WBCT. So this is very classical. For an Indian scenario, you need to think about Russell's viper bite. And you have a fourth category which is very notorious. You don't have any local signs, but you only have neurological manifestation. You don't see any fang marks, you don't see any swelling, blister formation, or nothing, but there is neurological manifestation. You have to think about common crate. So these are the four common presentation as an undergraduate or a postgraduate, that when you're dealing with the patients coming with snake envenomation, that you need to keep in your mind. Hope this video was useful to you. Thank you.